So now we're going to change gears a little bit here, and we're going to start with a couple of presentations before lunch regarding transfer of knowledge, which will be followed up after lunch for a number of other presentations. So it's my pleasure now to introduce you Juan Carlos López. Juan Carlos did his PhD at Columbia University in New York, and then he did a postdoc in Madrid in the Instituto Cajal. After a few years doing research in the lab, then he moved to be editor in Nature Review Neuroscience first, and later on a chief editor in Nature Medicine. And then in 2014, he became the head of academic relations and collaborations at Hoffmann-La Roche, based in New York City. And he's going to share with us some of his experience and thoughts on industry-academia relationships. So, Juan Carlos, thank you very much for being here.
Good afternoon. It's always a pleasure to come and see so many friends that I routinely see it, but I cannot get enough of you guys. I really love you. I commend the organizers for including several talks on this topic of transfer of knowledge, because everybody you ask would tell you that they're very interested in really making a difference for patients. And as it turns out, the way that this happens is really, it's really complex and pretty difficult, and not only because drug discovery is difficult, but just because we make it quite difficult. So today I'm going to tell you a little about my experience by thinking about science and really thinking about what is it that it takes for something to move from your lab or from your paper in a high-profile journal all the way to become a medicine. So I'll start by telling you a disclaimer. I'm an employee of Hoffmann-La Roche, that's been said already. But the other thing that I will say is that what I'm going to present is only my views, and I'm not speaking on behalf of the company. That if you're going to just remember one thing, that should be it. So let's start with the things that hopefully will be uncontroversial, right? And the first one is that the pharma industry is very interested in the innovation that's coming from academic centers. You ask any company in the world, they say, yeah, we're very interested in what people are doing. So that's cool. Now, the question is why? Why do we care about what's happening in the lab, right? The first reason is that there's so much science out there in the world that the amount of science that we are doing internally in each of our companies pulled all together is very small compared to all the biology that's happening in academic institutions. So it's like buying a lottery ticket. We have a few lottery tickets that we bought internally, but if we really want to hit the jackpot, maybe we should buy more lottery tickets from other people who are also playing the lottery of finding a new drug. The other thing is quite often we also look for new technologies, right? New technologies very rarely come out of pharma. Think about CRISPR-Cas9 and genome editing. That would have never come out of pharma, never. Right? So those kind of new technologies only come from academic research, and those are very, very important. Not so much for developing a new drug, but to help the discovery process. We want access to expertise. Internally, we can have people who know quite well Alzheimer's disease, but if we want to talk to the top experts in tau, they're not going to be working at Roche or at Novartis or any of our companies. They're going to be working out there in academia. So just the sheer expertise and the access to your knowledge is very valuable. And the other thing is that it's also cheaper. It's also cheaper to work with an academic lab that is quite well equipped and who is optimized to work in a certain model than try to bring that internally and start from zero. Right? That is just so expensive that it's just not worth it. Now, an important question, however, is what exactly is it that we're interested when we say that we're interested in academic research, right? So when you ask my colleagues in pharma, what is it that you're interested, everybody's going to tell you that they're interested in high-quality research, right? And what does that even mean? What does high-quality research mean? Does it mean, oh, you publish a paper in Nature? Is that what it means? Or does it mean something else? And I would argue that that's not what people are looking for. I put here the word critical because in my experience, this is the most abused word in the scientific literature. Everything is critical for some disease. Tau phosphorylation is critical for Alzheimer's. Kinase, whatever kinase you want, it's critical for IBD. Everything is critical. If everything were critical, we would have cured all of these diseases already, right? So things are really not critical, or at least not in the way that they lead to a therapeutic advance. They may be critical for some aspect of the disease, but not really critical in the sense of this is really going to help us cure a disease. And one of the big problems that people currently have when thinking about what is really critical to launch a discovery program in a company is the question of reproducibility. Yeah, so Pepe earlier today was presenting this controversial rebuttal that he got from his paper in Nature Neuroscience, and that is something that happens all the time, right? And this doesn't mean that the research is flawed. It just means that there are a lot of variations from system to system. Now, people in the pharma industry have thought quite seriously about this because we are the ones who end up spending a lot of money on discovery programs, and we want to make sure that whatever is it that we bring internally is actually legitimate. So there was a study that came out in Nature Reviews Drug Discovery several years ago showing that north of 80% of the research that academics publish cannot be reproduced. Yeah, and then you say, well, you know, what do those guys know? Well, talking to other people from other companies, that's the number you get. Talking to charities like the MRCT, we'll hear about in a while, that's also more or less what they get. 8 out of 10 papers cannot be reproduced, which to me is quite problematic. Yeah, so this is a challenge that I think needs to be addressed. Now, the other thing that is challenging is the question of prioritization, right? So let's say that we identify those things that are really critical for disease. We're still going to have a good number of things that are worth exploring. So how do we go about prioritizing them? How do we decide, okay, yeah, this is the right thing to go and to launch a drug discovery program on, as opposed to this other thing? And we're very bad at prioritization, right? We tend to lean a lot on what people call key opinion leaders, right? If somebody's a big name in the field and this person discovered this target, that is the target we need to go for. Well, maybe or maybe not. And this question, I don't think that we really know how to address it. What should be at the beginning of the queue and what should be second and third? It's hard. And then the other thing that is worth emphasizing in these general thoughts that I'm putting forward is that even at its best, the process is very inefficient. Yeah. So something happens in the lab. For that to really make it into a drug, it's a very inefficient process. And the reason is that the incentives of the different people who are involved in this process are misaligned. Yeah. So in the next slide, I'm going to talk about this question of misalignment, because to me that's really the most critical, return to the word critical, the most critical thing in converting an academic discovery into a medicine. So let's think about the different people along the chain that are involved in taking an academic discovery all the way to a medicine, right? So we start with the academics. What are the incentives for the academics? What makes the academics tick, right? So they want to discover how nature works and I understand a little bit more biology. But the reality is also that it's important to think about career advancement, right? So am I going to get tenure or am I not? Am I going to go from postdoc to assistant professor? And am I going to go from grad student to postdoc? Right? Career advancement is critical. Funding is critical. I need to publish, otherwise I'm not going to get grants. Right? So I'm under pressure to publish and to publish well. I want recognition. Yeah. And the other day in the New York Times, I read this article that compared scientists, not everybody, but many scientists, with what they call small business owners, right? And what that means is that there are many scientists now, unfortunately, who are running a small business, What they produce is papers that they sell to other scientists to get more money so that they can produce more papers, right? And this mentality of small business owner has been pretty counterproductive in scientific culture. And I'm perfectly happy to discuss this in more detail, but I think that it's important to acknowledge that in addition to caring about biology, we also care about career advancement. Now, foundations, for the longest time, foundations were giving money for research, and they say, yeah, let's fund research, and that's great because something good will come out of it. As it turns out now, more and more foundations are beginning to worry more about really advancing, moving the needle in terms of finding cures for the patients they care about. They care less and less about the scientists publishing good papers, and instead of, okay, how is this really going to help my relative who has this disease? So this is happening more and more, which is in a way welcome, but then it's misaligned with what the academics want from research. Now, governments need to think about other things. Of course, they would like to cure cancer or to cure Alzheimer's disease. So that's important to them. They want to see health benefits. They want to see drugs in the market. But the other thing they care about, and this is because this is short term, is economic growth, right? So if they give money for research, sure, I mean, we understand that curing Alzheimer's may take 10 years, but in 10 years I'm not going to be around as government. So what I want now is that whatever comes out of this research is useful to launch companies. Let's launch companies because then we can say that there has been economic growth. We've created jobs, we've stimulated the economy, and that's what's going to get my party re-elected next time around. Yeah, so it's a different incentive for governments. Even though they may have the long view, they also have other things in mind. Now, other people who are involved in developing drugs are people from venture capital and investors in general. Yeah, these are the people who put money in front. They like your idea. Let's build a company and let's go to the market. As it turns out, these people care about what they call return on investment. If I put $1 million, I want to make $10 million. Yeah, and I want to make $10 million in 5 years, because that's when my fund expires, and that's my deadline. So you'd better work hard. And that's how they function. Of course, they're happy if something makes it to the market, but what they want is an exit. Yeah, and that means selling the company to a big pharma company, or taking it out to the stock market, doing something that enables them to say, okay, I'll take my money now, thank you very much, and good luck with the next step. Yeah, so again, yeah, they may have the patients in mind, but really in the back of their minds. Yeah, and that's quite problematic. Now, people who are business development executives, these are the people from pharma companies who normally you interact with, right? You do interact with the scientists, but normally when somebody from a pharma comes to an academic institution, it's a business development person. Yeah, and this business development person may or may not be really in contact with the science. Very likely it's not going to be the person who say, this is great science, let's start a collaboration. It's quite often like an intermediary between the scientists in the company and you, the scientists in academia. And for these guys, yeah, of course they want to identify good stuff, but the way they are evaluated is how many deals did you do this year? If your target is 3 deals, did you meet that target, or did you do less deals than 3? Right, so the corporate targets is what's first in their mind. And for the pharma industry as a whole, you know, the pharma industry, you can argue, we are the ones who are stuck with everything at the end, because for us, the only exit is the market. If there are no new drugs, there isn't money. Right? We're going to have to close. So we're stuck with that. But even in that case, what I've observed in the pharma industry quite often is that people are really driven by milestones. In other words, if I'm going to advance this project from point A to point B, and my annual target is to get this project to point B, I'm going to do my best so that I meet that point, right? And so this advances them from point B to point C because somebody else's target is moving from point B to point C. And something that if you were very critical, you could have killed very early in the process, carries on until point F. And when it gets to point F, which is almost ready to go to a large-scale clinical trial, people say, you know what, this is not going to work. And that's why quite often projects are killed in pharma. They should have been killed very early on, but they survived all the way till the end. And that is problematic. So as you can see, different people who are part of this ecosystem are thinking about very different things when they approach the process of developing a new medicine. And because of this mess, is that the process is quite inefficient. So now how does one fix this, right? Because to come and say this and not come up with a solution, thank you very much. So I don't know. Let me start by saying that I don't know. But I'll tell you one of the things that I've been thinking about, that I've discussed with some of you. Do I still have a few minutes? 4 minutes. I'll go quickly then. So the question really is, what is it that we want to do with pharma? And another way to think about it is, what does it take for pharma to really get out of bed and really be interested in what I'm doing? At what point really they say, you know what, you're really sitting on something very valuable? And I hate to say this, but it normally is not after you publish a paper in Nature. That doesn't get anybody out of bed. What gets pharma out of bed is when you already have a molecule that is almost ready to enter into humans. That's what gets pharma out of bed. The question then becomes, how do we, as the academic community, get to that point? Yeah, and there are several formulas that people have explored, and we can talk about them. In fact, David here, who's our next speaker, works at the MRCT, which to me is like one organization that has really cracked this problem and are doing great work in that space. But I'm thinking more here in terms of what could Spain do to really become a true externalization partner of pharma, as I indicated here. So one idea that I discussed with some of you, especially with Miguel in the past, is the idea of learning really how to do drug discovery from the academic setting. Yeah, what would that look like? What would that entail, right? So I'll skip this. So to go directly to what would this look like? How would you create an academic drug discovery vertical that enables you to take something from discovery all the way to a valuable molecule, right? So you start with a wet lab, and the wet lab is able to do what I just said. So who's running this lab? So it is being run by people with pharma experience, right? Academics don't have the experience that is required for doing drug discovery. That's the first thing to understand. Yeah, all of you are brilliant, but you just don't have the expertise. So, and there are a lot of people out there. Pharma is firing people left and right all the time. There are very good experts out there. These are the people who need to be running this, right? And what they would do is they help identify what the best projects are from the academic environment, and then they would provide the advice that you don't get from the referees when you're publishing the paper. They will tell you, these are the 3 experiments that you need to do for this to become a real drug discovery program. So you will go and you do those experiments, and then the project will enter into the vertical. And the vertical is really formulaic, right? There's nothing fancy about drug discovery. It's formulaic. It's something that you can do, that there are methods to do. The key part is identifying the true projects that are going to add value. And for that, you need the expertise from the pharma people who are going to be running this, right? And so they will evaluate the discoveries, they will help you select the targets, and then the staff running this would be mostly people who have a track record in drug discovery. I won't talk about the governance, although the one thing I would say about this is that you shouldn't expect pharma to pay for this. This is something that needs to be financed by the country. How exactly that would work? It can be the government, it can be foundations. You need, so to break the news to you, for this to run for about 5 years, you would need about 20 to 25 million euro, right? So I don't know who has pockets deep enough for that. But if you think about it, it's pretty good, because at the end of those 4 or 5 years, you could sell a few molecules to pharma and recover all the investment. Yeah, so it's not that crazy. But it's important that you don't expect pharma to come and pay for this, because that's just not going to happen. And then what pharma contributes to this partnership is resources in kind. The industrial perspective on the science, this is how we do things, and this is how we would expect you to do things. the advice, as I was saying, this is a good project. Let's move forward with it, and let me advise you, but only advise you. And then they will give you something that also academics don't have, chemical libraries. Yeah, because doing compounds the way that people tend to do in academia, it's fine, but those compounds, 95% of the time, are not useful. Right? So you need this expertise from pharma. And then the outcomes and benefits, the main outcome is what I just said. At the end of the process, you have something that gets pharma out of bed, right? Which is what you ultimately want. So if I were to summarize my talk in one sentence, is if you really are serious about trying to commercialize the science that you're doing, then you really need to become more professional about it. Right? It's not enough to be a very good academic to get to the point where you have a valuable molecule. You really need to surround yourself with people who are professionals of this and who can help you do it. Otherwise, we'll continue talking about a lot of very interesting targets and really not move the needle in the direction of developing new therapies. And with that, I will say just one thing, these two things, if I may, Miguel. One is that this is not like a crazy idea. There are precedents. I already mentioned the MRCT as an example, and they don't exactly do what I just proposed, but there's an example there. In North America, there's one institution called the Harrington Foundation that is kind of doing something like this, but there really is a lot of room to do more of this. And the other thing that I would encourage you to avoid is what I've called the other people's problem, right? So whenever one gives this talk, there are always people in the audience who say, oh yeah, it's good you say that because we're already doing something like that, blah, blah, blah. No, people are not really doing something like that. People have ideas that maybe will lead in this direction, but I think that one needs to really examine very, very deeply the internal capabilities of the country and the set of skills that people have to do this. And then you'll conclude that, no, that it needs to become more professional and that there's a lot of room for growth and for really translating findings in a more efficient way. So with that, I think that's the last slide. So I don't know if we're going to take questions or if we just leave those for the panel, no? Yeah, cool.